Breast cancer signs, risks, diagnosis, treatment. Breast cancer is a type of cancer that forms in the cells of the breast tissue. Here's some general information on breast cancer. Signs and symptoms. 1. A lump or thickening in the breast or underarm. 2. Changes in the size, shape, or appearance of the breast. 3. Unexplained pain in the breast or nipple area. 4. Nipple discharge, other than breast milk, that may be bloody. 5. Skin changes on the breast, such as redness, dimpling, or puckering. Certain risk factors, such as family history, age, gender, early menstruation, late menopause, and hormone replacement therapy, may increase the likelihood of developing breast cancer. Several risk factors can increase the likelihood of developing breast cancer. It's important to remember that having one or more risk factors does not mean that a person will definitely develop breast cancer, and some people with breast cancer may not have any apparent risk factors. Here are some of the known risk factors for breast cancer. Gender. Breast cancer is much more common in women than in men. While breast cancer can occur in men, it is approximately 100 times more common in women. Age. The risk of breast cancer increases as a person gets older. Most breast cancers occur in women over the age of 50. Family history. Having a first-degree relative, mother, sister, or daughter, with a history of breast cancer can increase the risk, especially if the relative was diagnosed at a young age. Inherited gene mutations. Certain inherited gene mutations, such as BRCA1 and BRCA2, significantly increase the risk of breast cancer. Personal history. Women who have had breast cancer in one breast have an increased risk of developing cancer in the other breast. Breast density. Women with dense breast tissue on mammograms may have a higher risk of breast cancer. Hormone factors. Long-term exposure to estrogen and progesterone hormones, such as starting menstruation early or entering menopause later, can increase the risk. Reproductive history. Women who have never had children or had their first child after the age of the 30th of May have a slightly higher risk. Radiation exposure. Previous chest radiation, especially during childhood or adolescence, may increase the risk of breast cancer. Alcohol consumption. Regular and excessive alcohol consumption is associated with an increased risk of breast cancer. Obesity. Being overweight or obese, especially after menopause, can increase the risk of breast cancer. Hormone replacement therapy, HRT. Some types of hormone replacement therapy, particularly combined estrogen and progestin therapy, have been linked to an increased risk of breast cancer. It's important to note that while some risk factors are controllable, such as alcohol consumption and maintaining a healthy weight, others are not, such as family history and age. Regular breast self-exams, clinical breast exams, and mammograms can help with early detection and can potentially improve outcomes for breast cancer treatment. If you have concerns about your risk of breast cancer, it's best to discuss them with a healthcare professional who can provide personalized guidance and recommendations. Diagnosis. Breast cancer can be diagnosed through various methods, including 1. Mammography, X-ray imaging of the breast to detect abnormalities. 2. Ultrasound, sound wave imaging used to determine if a lump is solid or fluid-filled. 3. Biopsy, a sample of tissue is taken and examined under a microscope to determine if cancer cells are present. Treatment. The treatment of breast cancer depends on the stage, type, and characteristics of the tumor, as well as the patient's overall health. Common treatment options may include 1. Surgery, removing the tumor or the whole breast, mastectomy. 2. Radiation therapy, using high-energy rays to kill cancer cells. 3. Chemotherapy, using drugs to kill cancer cells. 4. Hormone therapy, blocking hormones that fuel certain types of breast cancer. 5. Targeted therapy, using drugs that target specific proteins involved in cancer growth. Curability. The outcome and prognosis for breast cancer can vary depending on various factors, including the stage at diagnosis and the effectiveness of the treatment. In many cases, breast cancer is treatable, especially when detected early. Early detection through regular breast self-exams, clinical breast exams, and mammograms is crucial to improving survival rates. It's essential to consult with healthcare professionals for accurate and personalized information regarding breast cancer diagnosis, treatment, and prognosis. They can provide you with the most up-to-date and relevant information based on your individual circumstances. Thanks for watching.